Allergies and asthma affect millions of people the world over. About 1 in 5 people suffer from some form of allergy. But for allergy and asthma sufferers, there's good news. You can find relief. Allergists have specialized training to help you identify and treat the cause of your allergies and asthma, not just the symptoms.
Not every problem in medicine is solvable, but allergy is highly treatable among all the medical conditions.
So I basically improved a lot over the years.
Now that I have my allergies under control, yes, my life is different.
My shots are making me better.
The specialization, I believe, really has helped Taylor with her allergies especially.
Allergists are the leaders in allergy and asthma treatment. In addition to an internship and residency after medical school, allergists complete specialty training in either internal medicine or pediatrics, followed by extensive and specific training that makes them uniquely qualified to find the source of your suffering and help you find relief.
So you need to do your 4 years of medical school, and then you need to do 3 years of internal medicine residency, and after that your fellowship in allergy and immunology, which can vary from about 2 to 3 years.
An allergist is a doctor who is an expert in the diagnosis and treatment of allergic diseases and conditions such as asthma and frequent cough, hay fever, sinus infections, eye allergies, reactions to food, insect stings, and drugs, skin allergies including eczema and hives, and immune system problems that might cause frequent infections.
All medicine is a combination of science and art. And so we have a lot more science than we used to, and we are continuing to learn a great deal more. There are actually 3 fundamental ways of treating allergies. The first is avoidance, so if you're allergic to peanuts, don't eat peanuts. That's the best way of not having a reaction. So avoidance, medication, and we have lots of good medicines these days, and finally, immunization or immunotherapy, allergy shots to change your immune system so it stops reacting to these substances.
I was diagnosed with allergic asthma when I was a baby. Now that I have my asthma in check, I make sure that I eat right, I have proper sleep, I exercise, and I try to stay healthy.
Asthma is a condition where the bronchial tubes in the lungs get inflamed, which causes constriction or tightening of the bronchial tubes and mucus production, and that makes people cough and wheeze and feel short of breath. One of the triggers of asthma is allergy, or one of the causes of asthma is allergy. Some people think that all asthma is allergic, but it's clear that at least 50% and higher, depending on the age group, is due to specific allergy.
If I was giving advice to someone that has asthma, I would tell them to get the proper care because a lot of times they're not getting the right medicine that they need to live a fulfilled life.
I get very frustrated when I see children suffer from asthma. Children are giving up having fun the way they should. They're not playing well. In addition, they're not sleeping well, and they're not performing in the classroom as well as they could because asthma is not well controlled in those children. Once the asthma is well controlled in those children, they play well, they sleep well, and they perform at a high level in the classroom.
Despite having asthma, I feel that I'm able to overcome a lot.
Medications can make a world of difference in children with asthma, and these medicines are quite safe because they control inflammation. And all children who have chronic, persistent asthma should be on medications designed to control the disease.
Many people don't realize that asthma is closely related to allergies, and that allergic reactions often trigger asthma. Allergists are experts in the diagnosis and treatment of both conditions.
I'm allergic to all dairy products, and once I have dairy products, then I have an anaphylactic reaction, which causes me to stop breathing.
Right now, she's extremely outgoing. She's extremely loving. When she was little, she was shy. I think that she was sad many times. I remember her being invited to so many birthday parties, and she would go to the birthday party and they would always have pizza or hot dogs and cake and ice cream. Well, Giselle's allergic to dairy, so you can't have the pizza with the cheese, and you can't have the ice cream, you can't have the birthday cake.
To become very disruptive. The kid's social interactions can be very constricted. One technique is to have them stop eating those foods and see what happens to their symptoms. If their symptoms go away, then you reintroduce the foods one at a time until you see which one causes a reaction.
While some people have serious allergies to certain foods, others may have food sensitivities. An allergist can help you determine if what you are experiencing is truly an allergic reaction.
Before I discovered that I had allergies, I was coughing all the time. I would be in line at the bank just coughing away, and it did not bother me at all to go and see an allergist, you know, as long as I was getting help to make me feel better.
Can I please make an appointment with the allergist?
Whether you have asthma, allergic rhinitis, also known as hay fever, or an eye, skin, or food allergy, it's important to see an allergist who is specifically trained to help you find the best solution.
Today is take a look at you.
Your allergist will develop a specific and individualized plan for your situation.
We really try to listen to our patients and get their full story. I remember this young man who was tired all the time, had dark circles under his eyes. He couldn't always stay awake at school.
When they're sick like that, you don't know what to do, and you've crossed all the roads of getting any medications and they just don't work.
I think he just was fatigued all the time from his nasal allergy symptoms. We tried some medications with him and it just didn't seem like it was helping. And a couple months later, I talked with his mom and really thought he would be a good candidate for allergy shots. And that's the course of treatment we decided upon.
It's all ready for you. If you have any questions on how to use your inhaler when you...
Allergy shots or immunotherapy is a mixture of controlled amounts of the things you are allergic to. Your allergist can find out what you are allergic to by performing a scratch test on your arm or back. They can then develop your shots and administer them over time, building up your body's resistance to the allergen.
I've been getting allergy shots for about 3 to 4 years, maybe. Basically, I only have to think about them like the day before, because sometimes I start sneezing the day before, so that means I need to get the shot. But usually, I don't think about it.
We can identify an allergen or something someone is allergic to. We can either have them avoid it, do desensitization such as allergy shots, and in a lot of cases that'll reduce their dependence on medication or even eliminate it in some cases. Makes them feel a lot better in most cases.
I have no problem with people taking over-the-counter medicines as a first step, but when over-the-counter medicines don't work, that's when you need professional help, and I think going to the allergist is a patient's best bet at having the problem understood and treatment very focused on that, solving that particular problem.
I believe it was her 4th birthday. She had a bad cold and she couldn't breathe very well. And we took her to the emergency room and they gave her an oxygen treatment and sent us home. After talking to our pediatrician, he suggested that maybe she needed some further treatment in the specialization of asthma and allergies.
The general practitioner may be able to identify that someone is allergic, but our role is really to help them. And we try to give them the information, meaning find out what they're allergic to, how to treat it, how to get the patient better.
We come in twice a week for allergy shots, which isn't always convenient, but since I can see a difference in her congestion and her breathing, it's definitely worth it. So, hello, Taylor.
Patients should expect a very thorough history because a lot of our details picked up in someone's history. They should expect a thorough examination. They should expect to be tested for what relevant allergies they may have. And they should expect an explanation of all the testing and all that they're going through. Once we identify what a person is allergic to, well, the first order of business is to try to eliminate or remove that offending allergen, and that's not always possible. If they can't completely eliminate that trigger, then allergy shots are a very effective way of reducing their sensitivity.
The allergy shots are helping me so I can be outside. They don't hurt at all. I am a strong kid.
Specialization in allergy and asthma treatment has come a long way, and allergists are now able to identify and treat hundreds of allergy types with symptoms that affect different parts of the body. Respiratory, skin, and eye allergies are among the conditions allergists treat frequently.
Well, after our fellowship training, we all sit for the boards, the American Board of Allergy and Immunology. So after that training, we actually sit for the boards again every 10 years to recertify.
I think allergists know the questions to ask. Not that other specialties don't understand it, but they don't sometimes take the time or have the time to ask the right questions, and maybe don't understand the pathophysiology as well as allergists might.
You don't need to treat somebody's laboratory test, you need to treat the person. And the way you know whether you're treating the person or not is by talking to them and taking good history. You take a history, you correlate it with the skin tests or the blood tests, and then come up with the diagnosis.
Allergies can be a mild inconvenience or they can be life-threatening. No matter how severe your symptoms are, an allergist can help. With years of medical fellowship training and continuing education requirements, allergists have the expertise to help you find relief.
I mean, you don't want to live at the hospital for the rest of your life. I mean, come here, get treated for it, then be a normal kid again.
I found relief.
I really believe if you find an allergist, you'll find relief.
You're making the right choice in going to see an allergist, but someone you know could be suffering needlessly. Share what you've learned with your family and friends. Tell them to find an allergist and visit allergyandasthmarelief.org. Brought to you by the American College of Allergy, Asthma, and Immunology.